Precision English for Healthcare SOWs HIPAA-Compliant Writing. Welcome! Today we'll sharpen your SOW writing for regulated teams. In healthcare and other controlled environments, exact wording isn't stylistic, it's compliance. Vague phrases create room for conflicting interpretations, which can raise legal and operational risk. If an auditor asks, "Who can access patient data and when?" your document should answer in one read, not 3 meetings. Clear, testable language also speeds approvals and audits because reviewers see concrete duties and limits, not guesswork. Think of precision as your risk reducer and your project accelerator. Tight words now prevent delays, rework, and findings later. Start with a clean core. Clearly define scope, deliverables, timeline, and cost. Example: vendor will implement patient portal MFA for clinics AD by Q3 for a fixed fee of $X. Explicitly name parties and roles. Covered entity, Northcare Hospital. Business associate, SecureTech LLC. Project owner, CIO. Spell out who approves what and by when. Then connect the SOW to policies and governing standards. Reference internal security policies, HIPAA rules, and any state privacy laws or accreditation frameworks. These anchors keep the work aligned with compliance, not just project preferences. Identify PHI precisely. What data, e.g., name, DOB, MRN, lab results, where it resides, EHR, data lake, backups, and why it's processed, treatment, payment, operations. Name the covered entity and business associate so duties are unmistakable, and note any subcontractor handling PHI. State the minimum necessary principle. Access is limited to the least amount of PHI required to perform defined tasks. Example: support engineers view error logs with masked identifiers. Unmasking requires ticket approval by the security lead. This framing narrows exposure, clarifies accountability, and satisfies HIPAA expectations. Lay out administrative, physical, and technical controls. Administrative, training, access approvals, incident response playbooks. Physical, badge-restricted server rooms, locked cabinets, clean desk. Technical, network segmentation, MFA, patching. Specify encryption in transit and at rest. For example, TLS for all interfaces and full disk, or database encryption for storage. Detail access control, logging and retention limits, role-based access, unique IDs, log integrity, 24/7 monitoring, and data retention/deletion schedules tied to policy. Each control should map to a clear action, owner, and system, making compliance auditable. Bake privacy into the build. First, collect only required data fields. Justify each element. We store email for MFA, not for marketing. Next, de-identify or pseudonymize whenever possible. Mask identifiers in analytics, use tokenization in test environments, and keep re-identification keys separate with strict controls. Default to least privilege, so new accounts start with minimal access. Provide opt-out clarity for secondary uses. Users can disable analytics sharing and profile privacy. Service remains functional. These clauses reduce risk, limit blast radius, and show auditors' privacy is intentional, not accidental. Your SOW must align with the Business Associate Agreement. Reference or attach the BAA and state that its terms govern PHI handling. Outline breach notification steps and timelines, who detects, who assesses, who notifies, and within how many hours of discovery. Example, business associate notifies covered entity security within 24 hours, provides impact analysis within 72 hours. Includes subcontractor flow-down obligations. Any subcontractor must sign agreements with protections at least as strong as the BAA and follow the same incident, audit, and training requirements. Alignment prevents gaps that regulators love to find. Make obligations provable. Use metrics like uptime, response time, and accuracy. Example, portal uptime 99.9% monthly. P1 incident response within 30 minutes. Reconciliation match rate is greater than or equal to 98%. Avoid vague verbs such as ensure, maintain appropriate, or as needed. Replace with concrete actions. Implement. Review weekly. Approve within 2 business days. Add verification. Monthly security reports, quarterly access audits, and user acceptance tests with pass/fail criteria. If someone can't test it or measure it, rewrite it. Clarity here shortens disputes and accelerates sign-off. Use this quick scaffold. Purpose. Provide patient messaging services. PHI used for delivering messages and audit logs only. Scope. Tasks include configuration, training, support, exclusions, marketing campaigns, deliverables, playbooks, admin guide, test results. Security. Safeguards include RBAC, MFA, logging, network segmentation, encryption in transit and at rest. Break glass approvals. Compliance. Subject to HIPAA, BAA attached. Breach notice to CE within 24 hours. Data retention 90 days for logs, then deletion with certificate. Drop this into your SOW and customize fields, roles, systems, and dates.